Mr. Massa, it's the end of an era.
What era has ended?
Boris Johnson, gone. No longer UK Prime Minister. Liz Truss is the new Prime Minister. Serena Williams, gone from tennis. By the way, she won her first US Open in the Clinton administration not long ago, having won 24, but beaten this week. And finally, Chelsea, my team, fired its manager, Thomas Tuchel, this morning after only less than 18 months after he won the Champions League. So, easy come, easy go in that case. It must be the September 8th edition of Health Tech Deals.
Well, that's 3 and out right there. You want to cancel this show and just make it 4?
I'm good at this. I'm good at this intro. Oh, you think I should be fired too as part of that?
Both of us.
Yeah, why? We're all gone. Okay, well, let's. We should stay around for like at least the rest of this episode. How about that?
Okay, how about that? Yeah, there's actual stuff to talk about. Lots of stuff.
Lots of stuff. Quite a busy week in the world of healthcare.
Yeah,
especially with somebody you know quite well.
I know.
A former Athena Health executive, funded by a guy with a very familiar name, who is close to being
familiar name, but that's where the similarities end.
That's because he's younger,
wealthy, good-looking, attractive, healthy, interesting, funny.
I know I'm all those.
Smart.
I know I'm all those things, but
no,
I'm not. Oh dear. Well, I haven't won you over. It's only been 4 years of doing this. Maybe you'll just know.
I know. Maybe now I'll get an interview with him.
maybe we saw that nice stuff about him. He did post on LinkedIn saying that, about this deal we're about to talk about. And I wrote in and said, don't forget your namesake 10%.
I think you're probably the first one off the list. All right. For Matt Holt out there, congratulations. CVS Health buys Signify for $8 billion. This is awesome news as far as I'm concerned.
Well, this is Carl Ambrose, former, I think it was chief product and then eventually head of strategy at Athena Health, took over Signify, 4 years ago? Went public a year and a half ago. Went public at like 24, stock shot up to 40, but it's been bouncing around the 11s, and now they're selling it for 30. So they were in the game of doing bundle payments. They bought Remedy, but they got out of that because CVS changed the rules of the game. But most of their business was in these home visits by nurses, and they have a bunch of infrastructure on that home visit. And they're doing a lot of home visits and recording of actual status, which was used in upcoding for the risk adjustment factor. George Halverson says on TCB that it's not done that anymore. A lot of money, though. $8 billion for a company doing about $400 million in revenue. So CVS has big ambitions and good exit for those guys.
I'm so excited for them. Congrats, Signify friends. All right. Psych Hub gets 16 million, brings their total up to 20 million. This is a mental health. It was a training app, and now it's doing some kind of matching.
Yeah, so it's basically a training app. CVS, talking about them as a run, I think 200,000 people through this to look for things like suicidal ideation, that kind of stuff. Patrick Kennedy, the U.S. congressman who's had mental health issues, is one of the founders, and Frisk Cressy Ventures and HC9 are in this, and they're going to try and do some matching. We'll see how that goes, but the training app is important.
All right, 98.6 gets 20 million plus. I don't know what the change is on that, but bringing virtual care now into hospitals.
Yeah, a bit weird. They've already raised like 250 million to build their own virtual care network, and now they're licensing out that technology to hospitals. Does that imply they're not doing so well in their own business? I don't know. We'll see, but tempting.
All right. What about MedMinder? MedMinder. They get 35 million, brings their total up to 75. This is a connected pill box.
Yeah, this market's been sort of coming and going, right? People have talked about connected pill boxes. It's important for, especially for patients, and compliance management. Really friggin' hard to do and hard to deal with. People have been scrapping in this market for a long time. Personally, now I'm an old man and I take 2 prescription drugs. Most of the time, I have no idea if I took them or not. I try to remember to take them in the morning when I brush my teeth. Sometimes I forget to brush my teeth. This is really hard. So the pill box, I get the whole thing, and they want to deal with polypharmacy and alert people about medications, go back and alert the pharmacist when the dose is missed. It's a great idea. A lot of people had a go at it. Hopefully they get somewhere. Hopefully.
Yeah. This is cool. I don't know. What an assortment of deals today. All over the place.
I mean, but it's a bit more like what we said, right? Which is that those in this case, a huge public company which owns, both Aetna, the health plan, and CVS, the retail store, taking out Signify and sort of rounding it up. Now, it's a little different to some of the other ones. I know that United bought that long-term care company, and Humana bought Kindred. They're more like long-term care staffing. These guys are more like infrastructure, but they do these check-ins. There's a big argument about whether that they're used to help the risk adjustment factor and bump up Medicare Advantage rates, or whether it's just to improve Medicare Advantage. Those who want to know more about this can read George Halverson, who's published twice on this topic in the last week in the healthcare blog. He has a very firm view about it, not shared by anybody else, but it's interesting stuff. But I mean, it's interesting, right? Because they bought Remedy, and now that business, they actually shut it. They took a $500 million charge. So literally they lost all the money last year. I don't know how you get a $500 million charge on a business that's only doing about 100 million in revenue, but they basically said they were getting out of that, closed it down, got rid of a whole bunch of people who were in that sort of bundle payments initiative. But they did buy that ACO bundle payments company, Caravan Health, a while back, and that apparently is still going. So they're sort of servicing ACOs. CBS, it's hard to figure out. They're buying a lot of different stuff. They're obviously, some people say that Amazon said they were interested in Signify just to make CBS pay more. That's true or not. But the rumors it was going to go for $6 billion, and it went for $8 billion. So there was, that Matt Holt, Carl Ambrose team, they got their pound of flesh out of this.
Pound of flesh.
They still one of your sponsors?
Yeah. Yes.
Well, now you can, and you do work for CBS as well.
I've got a great track record with
hang on, you're combining, but just you're combining your sponsors. Now you're going to get one check instead of two.
I know. I mean, like
the other way, you get
my sponsors have done great historically.
Yeah,
Livongo, Ginger, Signify. I mean, like these are sponsor me.
Well, I mean, sponsor you if you want. I said the thing is, come sponsor Jess. I'll get us out of here. It's like what I said. I'll get us out. Right.
Okay, so, good. Go.
To find out more about Chelsea's managerial management go-round, follow me on Twitter at BoltyBoy. She's at Jess DaMassa, and you can follow her and sponsor her WTF Health shows if you want to get taken over by a really big company like CVS or anyone else. Guaranteed. Sponsor Jess DaMassa, you become rich. It's like a
good track record.
And if you want to know more, you can go to thehealthcareblog.com, sign up for our newsletter, and that's about it. I'm probably the last time I'll ever be allowed to do this. No,
you did great.
And extra before I get fired.
You did
along
great.
With Johnson, Serena Williams, Thomas Tuchel, and Matthew Holt all out the door. Replaced soon by a better, newer, sexier, much richer Matthew Holt.
Well, maybe when he's going to retire, maybe, and he'll have nothing to do but weigh in on health tech funding deals.
Those guys with too much money on Wall Street, they never quite quit.
No. Matt Holt, hit me up.
We'll see you soon. Bye.